Hey everyone, in this video I'm going to talk about 3 most common blades, surgical blades that I use for minimally invasive foot surgery. So write that. Hi, this is Dr. TJ An. Again, in this video, I'm going to talk about 3 most common surgical blades that I use in MIS surgeries. So number 1, 67 MIS. 67 MIS blade. When do I use this? It's for typically soft tissue release, like tenotomies and capsulotomy around the digits or metatarsophalangeal joint of the foot. And I typically use 67 MIS for more dorsal approach incisions. Plantar, I use different blade. So pretty much, that's what I use 67 MIS for. Some doctors use 18 gauge needle for tenotomy and soft tissue release. I just prefer actual blade, but anyway, it's a surgeon's discretion. Second blade that we use as a minimally invasive surgeon is 62 blade. 62. I use typically 62 blade when I do plantar approach, flexor tenotomy, capsulotomy, release, and also just kind of use plantar incision at the near MTPJ level for my go-to minimally invasive hammer toe procedure when I do plantar approach for the base osteotomy of proximal phalanx. Reason why I like 62 blade is that it has a cutting surface only at the distal tip. It doesn't have a cutting edges on the side or corner. It just have a purely like square and only at the distal tip. So beautiful thing about that, when you do flexor tenotomy of the digit, when you do a incision, you do a vertical, which is parallel to the long axis of the digital bone when you enter. Then when you turn the blade around to release the ligament and tendon, and then you dorsiflex the toe, it does not split the incision. So I like the vertical manner, the plantar incision, and then you can turn the blade without risking cutting the incision sideways. And third one is 64 blade. Number 64 blade, pretty much used for everything else. 64 for first metatarsal osteotomy, medial plantar incision, medial incision, Aiken type osteotomy, I use that. Lesser metatarsal osteotomies and Taylor's bunion, I use 64. Some rear foot osteotomy like calcaneal osteotomy, I use 64. Even plantar fascia release, plantar approach, I use 64. So I hope this video give you a quick overview of 3 most common surgical blades that I use and most MIS surgeons use that I know. Again, don't forget to follow my channel. Thanks for watching my channel, and give me thumbs up, subscribe to channel. If you have any question, leave me a comment below so that I can get back to you through either this platform, or if you want to connect with me, the email, my email address is also in the below. Again, I do a lot of live cadaver lab course, coaching course, and also business course. So if you haven't followed up my channel, don't forget to subscribe. Yeah, that's it, and thanks for watching this video, and I'll see you in the next video.